from Croaky here at the National Nursing Forum, and I have here one of our very special keynotes today making an announcement. Would you be able to introduce yourself, please?
Hello, my name's Patsy Yates. I'm a Professor of Nursing from QUT in Brisbane.
And very well known in the sector and across health generally. You announced today, although I think it has been completed before, could you talk about that white paper that you announced?
So the Australian College of Nursing has been really trying to work on key areas of health policy, one of them being end-of-life care and the nursing role. So they've set up a policy chapter and asked us to sort of think about, well, what might be some ways in which we can positively influence policy around end-of-life and particularly the nursing contribution. So what we did to sort of really help frame that was start with by developing a white paper. So we did a review of the evidence. We looked at what the evidence tells us around how nursing can contribute to achieving good outcomes for all people in our community, reducing some of the barriers to access. So the white paper is a great document. It summarises the evidence. It tells us that nurses are really critical to symptom management, to goals of care discussion, to coordinating care, and that if we get and support those models, that we will get better outcomes and we will reduce the variation in access as well.
And that's if you get the support. Your evidence found some variation and barriers.
Yeah, that's right. The evidence that the literature told us that with the models of care they really work when there's good systems of support. So when nurses have the appropriate education, when they're part of a multidisciplinary team that refers and involves and enables nurses to work to their scope of practice. And that's not always the case. We also sort of saw there were some really good studies which are telling us that there's great possibilities if we think about how to better use technology, for example, to have greater reach to communities who have typically been underserved in terms of really good quality end-of-life care.
And who are those communities?
So oftentimes it's rural and remote communities. It's some of our Indigenous populations because many of our palliative care services aren't necessarily haven't got cultural safety practices and while there isn't that much evidence in Australia, the evidence from overseas that have looked at end-of-life care models for First Nations people give us some really good clues as to the sorts of things that we need to do to understand how to better address the needs of our Indigenous populations, for example.
And are these issues on the government's agenda?
They are. Look, I think, the Australian government has got a national palliative care strategy and it has had for a long time. And this is now a newly released national palliative care strategy. And that strategy does very much emphasise the importance of systems and governance because end-of-life care is actually requires the coordination of care across federally funded services as well as state-funded services and some community, and it's not necessarily just health either, it's oftentimes community and social services. So yes, the strategy looks at that, the strategy looks at workforce. So there's a good strategy. There has been some investment in programs. Whether or not that all trickles down and whether all of the states and territories are also got their own versions of end-of-life strategies. But part of the challenge, I think that all governments are seeing this as a priority. The challenge is though getting our coordinated effort to make sure that we're using the resources that we have to their optimum. And I think that really critically means nursing as part of the biggest part of the workforce. And if we're not actually maximising how nursing can contribute, then we're probably not going to get the best outcomes.
And you've made some calls to action on that.
Yeah, so the calls to action we put forward in this white paper after reviewing the evidence was that we clearly need to have new funding, adequate funding for models and models which are truly embedded and consistently across our system. So funding and that funding also includes support for the workforce. Second call to action we made was really related to the ability to overcome some of our barriers, system barriers and legislative barriers, for example, that might sort of get in the way of nurses working to their scope, say in terms of prescribing, for example. Or simple referral practices at an organisation level can sometimes be, it has to be referred by someone and a nurse can't refer, and things like that are just silly when we need to get access to care. And a third call to action was really around how we can best look for the future and actually look at sort of innovations in the way that services are delivered as well.
And just on a personal or a case study basis, what stood out as best practice? What did you hear about that was great?
Yeah, so best practice is where we have a nurse who is skilled and educated to provide true person-centred care. And that sort of, everyone talks about person-centred care, but in end-of-life care, that's all what it's about. And that person-centred, individualised approach to identifying a person's needs, whether they be physical, emotional, social. So symptom management, addressing an individual person's needs. Secondly, it was where the nurse or other health professionals were able to have good, open, honest conversations in a way that was sensitive to where the person was at. So good goals of care discussion. And thirdly, it was actually where we had nurses who were very good at enabling to work around the system, so coordination of care, because it does require so many parts of our system to work together. And we've got too many sort of barriers between walls in our systems that sometimes what nurses did, they're pretty good at finding workarounds and coordinating a person's care to get the best outcomes.
That's great. Now, sadly, as always in these discussions about palliative care, it prompts a discussion around voluntary assisted dying. In Victoria, we've actually had the first case revealed of somebody who's used the new act there. Yeah. What are the implications for nursing there, and what's been done?
Yeah. So I think the main implications relate to, from a nursing perspective, is that nurses are supported and adequately prepared to deal with requests for voluntary assisted dying. I think that the legislation has been introduced in Victoria. There's discussions. There's an inquiry in Queensland, an inquiry in West Australia. Like it's a hot discussion in our community and clearly in our parliaments at the moment. If such legislation is going to be implemented, we have to make sure that our healthcare professionals are adequately prepared. Otherwise, there may be unintended or adverse consequences both for our community and for our health profession. So education is one, supports, and part of that education is actually really about communication. It's about helping people understand their own values, helping people understand how they can work within a system that may sometimes challenge their own values.
My understanding is that nurses aren't actually involved in any of the processes towards a decision, but in fact can be in that referral role that can be raised with them if the patients wish to do so.
Absolutely. And even if it's not raised with them directly, the nurses are still there caring for those patients, and those patients will most likely be needing supports, the patients and their carers, and to think that even though nurses might not be part of the legislative framework in that sense, they are not just bystanders. They are actively involved in supporting all people at end of life, and so whatever their choices, and it's just so critical that we that they are supported to do so.
And is it your sense that they are getting that in Victoria? Is that being examined closely?
Look, I think that people are aware of the importance of it.
By people, you mean health systems?
I think health systems. I think the profession. I think, but I think though that the complexity of it, I think, makes this a really challenging. So it's not like it's you can just easily roll out a learning module, and think that that's going to be done. Certainly, the cognitive part, the education part, the knowing all about the framework and how the legislative framework and your legal obligations is one thing, but it's the other side of truly feeling confident with your communication. Truly having somewhere that can support you as a person as needed in our workforce. I'm not sure that we've sort of got all of those pieces in place sufficiently at this point.
So who's responsible for that?
Well, I think it's a combination of I think governments, if they're going to introduce legislation, they have to have all of these things, and I think that the governments are. putting in place what some things, but I think it's just the complexity of it means that we just don't take for granted. I think the profession, and I know the college, we've put out as part of our policy chapter, we also developed a guidance document which was really about highlighting the implications for the nursing profession, part again of that sort of advocacy, raising awareness. So we've done that. And I think that the college is looking at its role in education as well. But I think also as individual professionals, how we can sort of also be reflective and understand the impact that our work has on us, and that we, through that, sort of know when we need to sort of seek support and help and advice.
Thank you very much. Any other comments you wanted to make about that or about the conference?
Well, the conference has been fantastic. I think, this is quite unique, the Australian College of Nursing. It sort of brings together nurse leaders from across all different sectors. But what's been great about this conference is that they've really had a great emphasis on emerging nurse leaders. And, that's the future. And I've been around sort of a few decades in the profession, and actually to see our emerging nurse leaders absolutely engaging in the discussions and being active in the debates, it gives me so much hope for healthcare in the future.
Fantastic. Thank you very much.